Picture yourself at 75, feeling vibrant and healthy, when your doctor suggests a battery of screenings just to be safe. What if I told you that some of these well-intentioned tests could trigger a cascade of unnecessary procedures, anxiety, and even hospitalizations that rob you of the very health and peace of mind you're trying to protect? Before we dive deeper, show your support by hitting that button. It helps Elderly Active Life reach more people who need this vital information. We upload fresh, evidence-based content every single day, so subscribe and ring the bell to stay informed. Today, we're expanding our exploration beyond the basic 5 screenings to examine 9 specific tests that often cause more harm than good for seniors over 70. We'll uncover why the medical system sometimes fails older adults, share real stories of people whose lives were upended by unnecessary procedures, and arm you with the knowledge to make truly informed decisions about your healthcare. Test number 1. The colonoscopy crossroads when prevention becomes perilous. Margaret, an 83-year-old retired librarian from Vermont, had enjoyed 2 decades of clean colonoscopies. When her doctor suggested one more for good measure, she agreed without hesitation. The night before the procedure, the bowel prep left her severely dehydrated. During the colonoscopy, her aging colon suffered a small perforation, a complication that occurs in 1.5 out of every 1,000 procedures for people over 80. What followed was emergency surgery, 2 weeks in intensive care, and months of recovery that she never fully completed. The hidden mathematics of risk. Research reveals that seniors over 65 experience adverse events in 26 out of every 1,000 colonoscopies, but this jumps to nearly 35 per 1,000 for those over 65-80. The most concerning aspect? Many of the polyps discovered in elderly patients grow so slowly that they pose virtually no threat during a normal lifespan. These incidentalomas often trigger a cascade of repeat procedures, biopsies, and even surgical interventions for conditions that would never have caused problems. The sedation dilemma. For older adults, the sedatives used during colonoscopy metabolize differently, often leading to prolonged confusion, dizziness, and increased fall risk. Post-operative cognitive dysfunction, a form of temporary brain fog, can persist for weeks or even months, particularly devastating for seniors who live independently. Smarter alternatives. Non-invasive stool tests like FIT, fecal immunochemical test, or Cologuard can detect concerning changes without the risks of sedation, dehydration, or perforation. These tests aren't perfect, but for seniors with previous clean screenings and no symptoms, they offer a reasonable balance of safety and vigilance. Still with us? Drop number 2 in the comments to let us know you're learning alongside us, and don't forget to subscribe to Elderly Active Life for daily doses of health wisdom. Test number 2, the full body scan mirage when technology creates problems. 79-year-old Robert from Arizona was feeling fantastic. Daily walks, sharp mind, no complaints. A health fair offered discounted full-body CT scans, and the marketing promised peace of mind through early detection. The scan revealed a tiny nodule on his lung, smaller than a pencil eraser. Despite having no respiratory symptoms and a lifetime of never smoking, Robert was thrust into a world of pulmonologists, follow-up scans, and eventually a biopsy that collapsed his lung. The incidentaloma epidemic. Advanced imaging technology can detect abnormalities smaller than ever before, but sensitivity doesn't always equal usefulness. Full-body scans routinely uncover harmless variations that radiologists must report as findings, tiny cysts, minor calcifications, and age-related changes that would never cause symptoms. These discoveries launch what medical professionals call the cascade of care, a series of tests, procedures, and anxiety that can consume months of your life. The psychology of abnormal. Research shows that seniors who receive ambiguous test results often experience persistent anxiety that affects their quality of life more than any potential disease would have. The word abnormal on a medical report can transform a confident, active senior into someone who views their body with suspicion and fear. The financial burden. Most full-body scans aren't covered by insurance unless there's a specific medical indication. Seniors often pay thousands out of pocket, believing they're investing in longevity, only to discover they've purchased a ticket into an expensive medical maze with no clear exit. Test number 3, cardiac stress test troubles when your heart gets falsely accused. James, a 76-year-old grandfather from Illinois, was preparing for his annual physical when his doctor suggested a stress test just to check everything's working properly. James had no chest pain, no shortness of breath, and could still chase his grandchildren around the yard. The treadmill test showed minor ST wave changes, a common finding that's often meaningless in healthy older adults. Within 3 weeks, James was in a cardiac catheterization lab, receiving a stent for a blockage that had never caused symptoms. The blood thinners required after the procedure led to internal bleeding, and James spent the next 4 months recovering from complications related to a test he never needed. The false positive phenomenon. In asymptomatic elderly patients, stress tests produce false positive results up to 89% of the time. Why? Aging naturally changes the heart's electrical patterns, blood vessel flexibility, and response to exercise. What the test interprets as abnormal may simply be the normal aging process, but distinguishing between pathology and natural aging requires expertise that's often missing in the rush to do something. The cascade of intervention. A positive stress test, even a false one, often leads to cardiac catheterization, a procedure that carries risks of bleeding, stroke, kidney damage, and infection. Once you're in the cardiac system, each test seems to demand another, and each intervention creates new risks that compound over time. Age-appropriate heart care. For seniors without cardiac symptoms, the most effective heart protection comes from daily movement, social connection, stress management, and maintaining a sense of purpose. These lifestyle factors have proven benefits without the risks of invasive testing. Test number 4, mammography misconceptions when early detection becomes overdetection. Eleanor, age 78, had been getting mammograms faithfully for decades. Her latest scan detected a small cluster of calcifications, a finding that led to stereotactic biopsy, MRI, and eventually surgery for ductal carcinoma in situ, DCIS. What Eleanor didn't know was that many experts now consider DCIS a precancerous condition that may never progress to invasive cancer, especially in older women. The overdiagnosis reality. New research reveals that 31% of breast cancers detected in women ages 70 to 74 may be overdiagnosed, meaning these cancers would never have caused symptoms or shortened life. For women 75 to 84, this rate jumps to 47%, and for those 85 and older, a staggering 54% of detected cancers may represent overdiagnosis. The treatment burden. Even early-stage breast cancer treatment can be devastating for older adults. Surgery, radiation, and hormonal therapies can cause fatigue, cognitive changes, and complications that significantly impact quality of life. When the cancer being treated might never have caused problems, the treatment becomes the primary source of suffering. Personalized decision-making. Rather than automatic annual mammograms, older women benefit from individualized discussions about their health status, life expectancy, family history, and personal values. Some may choose to continue screening, while others may decide that the risks outweigh the potential benefits. Test number 5, prostate screening pitfalls, the PSA predicament. Harold, a healthy 77-year-old retiree, agreed to a PSA test during his annual physical. The result came back slightly elevated, leading to a urologist referral, prostate biopsy, and ultimately surgery for a cancer that his doctor admitted probably would never have bothered you. The surgery left Harold with incontinence and erectile dysfunction, complications that persisted for the rest of his life. The overdiagnosis crisis. Studies suggest that up to 2/3 of prostate cancers detected through PSA screening represent overdiagnosis. Many prostate cancers grow so slowly that men are far more likely to die with the disease than from it, especially after age 70. The anxiety factor. Research shows that false positive PSA results create anxiety that can persist for up to a year, even after follow-up tests prove negative. This psychological burden affects relationships, sleep, and overall life satisfaction in ways that extend far beyond the medical system. Guidelines and reality. The U.S. Preventive Services Task Force recommends against PSA screening for men over 70, yet many continue to receive these tests. This disconnect between evidence-based guidelines and clinical practice leaves many seniors exposed to unnecessary risks. Test number 6. Bone density burdens. When strength testing weakens your wallet. Dorothy, 73, received her bone density scan results showing osteopenia, a condition that affects millions of seniors and often represents normal aging rather than disease. Her doctor immediately prescribed expensive bone-building medications with potential side effects, including jaw necrosis and unusual fractures. What Dorothy didn't realize was that her fracture risk remained quite low, and the medications carried their significant risks. The frequency fallacy. Current guidelines recommend bone density testing every 2 years for seniors, but recent research suggests this may be excessive. A Harvard study found that repeating bone density tests every 4 years identified nearly as many at-risk individuals as testing every 2 years, with far less cost and inconvenience. The treatment threshold trap. The diagnosis of osteoporosis relies on comparing an elderly person's bone density to that of a healthy 30-year-old, a standard that may not make clinical sense. Some bone density loss is natural with aging, and treating every senior with below-average bone density may subject many to unnecessary medication risks. Cost-effective prevention. For most seniors, the most effective bone protection comes from regular weight-bearing exercise, adequate vitamin D, fall prevention strategies, and maintaining muscle strength. These interventions cost little but provide comprehensive benefits that extend far beyond bone health. Test number 7. Thyroid testing troubles. When normal aging gets misdiagnosed. Patricia, age 81, felt tired more often than she used to, a common experience for someone her age. Her doctor ordered thyroid function tests that showed a mildly elevated TSH, thyroid-stimulating hormone. Despite having no other symptoms, Patricia was started on thyroid hormone replacement. The medication made her feel jittery and anxious, but her doctor insisted she needed to continue treatment for her subclinical hypothyroidism. The age factor ignored. TSH levels naturally rise with age, and what's considered abnormal for a younger adult may be completely normal for someone over 75. Many experts now recommend using age-adjusted reference ranges that account for this natural progression, but this practice isn't yet widespread. Subclinical conditions, real consequences. Subclinical hypothyroidism, elevated TSH with normal thyroid hormone levels, affects up to 10% of seniors, but rarely causes symptoms or requires treatment. Studies show that treating these mild abnormalities in elderly patients provides no benefit and may cause harm through overmedication. The French approach. French endocrinologists have pioneered a more age-appropriate approach, dividing a patient's age by 10 to determine the upper limit of normal TSH. This method significantly reduces overdiagnosis and prevents unnecessary treatment in healthy seniors. Test number 8. Diabetes screening dilemmas. When blood sugar numbers mislead. Walter, 79, had his annual fasting glucose test come back at 128 milligrams per deciliter, just above the normal threshold. Despite feeling well and maintaining an active lifestyle, his doctor diagnosed him with diabetes and started him on medication. The drugs caused dizziness and falls, but his physician insisted that treating the diabetes was essential. The false positive problem. Diabetes screening in older adults carries a surprisingly high false positive rate. One study found that nearly half of the people diagnosed with diabetes through screening would test normal on repeat testing within a year. This variability reflects normal fluctuations in blood sugar that increase with age. The medication cascade. Once labeled with diabetes, seniors often begin a complex regimen of medications, frequent monitoring, and dietary restrictions that can significantly impact quality of life. For borderline cases in elderly patients, these interventions may cause more harm than the mild elevation in blood sugar they're designed to treat. Lifestyle versus medication. For many seniors with mildly elevated blood sugars, lifestyle modifications, gentle exercise, balanced nutrition, stress management, may be more appropriate than immediate medication. These approaches improve overall health without the risks associated with diabetes drugs. Test number 9. The path forward. Reclaiming agency in your healthcare. The stories we've shared aren't outliers. They represent a widespread problem in how medicine approaches aging. Too often, the healthcare system applies one-size-fits-all protocols without considering the unique needs, values, and circumstances of older adults. Questions to ask before any screening. 1. What will change if this test is positive? If the answer is more tests rather than better health, consider declining. 2. What are the risks of the test itself? Every medical procedure carries risks that compound with age. 3. How will this affect my quality of life? Sometimes the best medical decision is the one that preserves your peace of mind and independence. 4. What would happen if I wait? Many conditions develop slowly enough that watchful waiting is a reasonable approach. The art of selective screening. Wise healthcare after 70 isn't about avoiding all medical care. It's about being selective. Focus on symptoms that bother you. Maintain preventive care that has clear benefits, like blood pressure monitoring, and decline interventions that are unlikely to improve your life. Building your healthcare team. Seek providers who understand geriatric medicine and respect your autonomy. The best doctors for seniors are those who ask about your goals, listen to your concerns, and help you navigate the complex balance between intervention and acceptance. Creating your personal health philosophy. Consider developing a clear statement of your healthcare values. Do you prioritize longevity at all costs or quality of life? Are you comfortable with some uncertainty, or do you need to investigate every abnormal finding? Having these conversations with family members and healthcare providers before you need them can prevent unwanted interventions during vulnerable moments. The power of informed refusal. Remember that you have the right to decline any test or treatment, regardless of what guidelines recommend. This isn't medical negligence, it's an informed choice. When you understand both the benefits and risks of medical interventions, choosing to forego certain tests can be the wisest decision you make. Your health, your choice. Growing older doesn't mean surrendering your autonomy to the medical system. It means becoming more discerning about which interventions truly serve your goals and which ones merely serve protocols designed for different populations. Take action today. Share this video with someone who's feeling overwhelmed by medical recommendations. It might save them from unnecessary procedures and anxiety. Remember to like this video and subscribe to Elderly Active Life for daily content that respects your wisdom and supports your journey toward healthy, independent aging. What resonated most with you from today's discussion? Share your thoughts in the comments below. Your experience might help another viewer make a crucial healthcare decision. See you tomorrow. Until then, stay curious, stay informed, and most importantly, stay in charge of your health journey.